Hi, my name is Leonard. I'm student ID number 3345462, and this is my AVMA task video for veterinary nursing care, VTHT 2439-33430. So I'm going to demonstrate how to run an ECG. So an ECG measures the electrical impulses of the heart. And you want to make sure that you have your dog in right lateral recumbency as long as they are healthy and stable. If your dog is not stable, you can do them in whatever position is easiest for them to breathe in. You want to make sure that your dog is as calm as possible. Oh. Any wiggling causes artifacts, which is that interference that you see on there. So kind of wait for her to calm down a little bit. We're trying to get that evened out. And we have our white, red, and black clips. I remember them as white on right. So that's going to go in the, oh, they're all twisted. That's going to go on our top right leg, just proximal to the elbow. And then we have our smoke over fire, so black over red. And that's going to go right here, again, just proximal to that elbow and proximal to the stifle. And we're going to make sure we get those saturated with some alcohol. Oh, I know, it's chilly. And we want to make sure, oh, and there's two more leads that we just don't have at our hospital. That first one would be green, and that would go on the right stifle. And I remember that as clouds over grass. And then there's also a blue lead, or I'm sorry, a blue clip, which would, these are all clips, not leads. A blue clip, which would go at the sternum. And so we're going to go ahead and let that read for a second. Let's see, I'm going to kind of play with that gain a little bit. See if I can make it a little bit bigger. There we go. That's a nice reading. I'm going to go ahead and let that run for a minute, and then we'll print it out and we'll read it. Okay. Let's see. So here is our ECG reading, and what we're looking at here is we have our P wave, which is that wave right here, and then we have our PR segment, our QRS, followed by our ST segment and our T wave. And everything is nice and evenly spaced. It's a nice even pattern. Everything matches, there's no abnormalities, and so I would call this a nice healthy ECG reading. P waves that we have there, that's the atriopolar depolarization, and then we have, that PR segment. The QRS is the ventricular depolarization, that ST segment, and then our T wave right there, that is our ventricular repolarization. Okay, so I'm going to go ahead and perform a Schirmer tear test. So this is going to check and make sure she is producing tears properly. Hi, pretty girl. I'm going to go ahead and I'm going to take out my test and I'm going to bend it right at the line. I'm being careful not to touch the tip so my oils don't affect the test. There we go. And then what I'm going to do is I'm going to go ahead and pull down her lower lid and place it between her lower lid, the conjunctiva of her lower lid, and her cornea. And I'm going to hold it there for 60 seconds. I'm going to close her eye. I'm going to be careful not to, oh, she's blinking with her. I'm going to be careful not to squeeze her eye because that could cause a higher tear production than there actually is. So I'm just going to hold it there gently for 60 seconds. Let's see the time. Okay. Okay, good girl. All right, so our reading is at about 23, and a normal reading would be greater than 15 millimeters over 60 seconds. So she has appropriate eye lubrication. So I'm going to go ahead, and that is our Schirmer tear test. Okay, so we're going to go ahead and do our eye fluorescein stain test. So I'm going to go ahead and take my plunger out of my syringe, and I'm going to open up my test. She does have a little bit of proparacaine in there from a previous test that we did. I'm gonna go ahead and place that in there. And I'm gonna pour some eye wash in. About 3 ml of it. And I'm gonna place my plunger. There we go. All right, come here, Summer. Come here. Sit. Sit. Good girl. And so what I'm gonna do is I'm gonna go ahead and have Patricia hold her head still. And I'm gonna go ahead and place, just blinking on me. Drop right in her eye. I'm gonna go ahead and hold some gauze underneath. Sorry, Patricia, got your fingers. Hold some gauze underneath. I'm gonna rinse out her eye with this blush. It's an eye wash. There we go. Good girl. Okay. And then I'm gonna go ahead and turn out the light. Oh, thank you. We're gonna turn on our Woods lamp black light. And we're gonna shine it on her eye. And we're looking for any uptake. So if we saw any uptake on her eye, it's gonna be something like maybe an ulcer or some sort of cut or scratch. She does have a little bit of uptake in the corner of her eye, but that is just normal discharge. You can also see a little bit at the tip of her nose there. But I would say that she is negative. We can turn the light back on. She is negative for any ulcer or scratch on her eye, and she would be a safe candidate to have an eye medication with a steroid in it. Okay, so I'm going to demonstrate a Tonapen now. So I'm going to go ahead and put some proparacaine in her eyes. And while that is working, I'm going to go ahead and calibrate my Tonapen. So for this Tonapen specifically, you only have to do it when you change the battery. But you hold the button for 5 seconds. Oh, I'm sorry. Hold it upside down. Hold it for 5 seconds. It should beep 5 times. Move it up. And it says pass right there. So now we're good to go ahead and use our Tonapen. I'm going to go ahead and remove the cover for my new cap that's on there. And that, I'm going to go ahead and hit my little button. I'm going to tap it to right in the center of her eye. You can hear tiny little, if you wouldn't mind holding her head, kind of perfect. All right. You hear tiny little taps. All right, got a reading of 22. We're going to do it 3 times. Right, 25. And we'll do it one more time. Reset itself. There we go. And we got our tiny little taps. And 23. So those are all really good readings. So between 12 and 25 is going to be MMHG is going to be your ideal reading, and so she had really good ocular pressures on her left eye there. Okay, so I'm going to demonstrate how to give an enema to a dog. This is Pepper, and she does not actually need an enema, so we're just going to go ahead and pretend to do so. So we're going to use a warm water enema. I already have a little bit of lubrication in here, so I'm going to make sure I add some warm water to it. Make sure it's not too hot. You don't want it too cold or too hot. You don't want it any warmer than body temperature. And I'm going to go ahead and use my syringe here to kind of mix it up a little bit. Get that ready. I'm going to go ahead and pull some into my syringe. Your doctor is going to tell you how much they want you to administer. And I'm going to go ahead and put some lubrication on this paper towel so that I can lubricate my red rubber.
Can I have Bella Palmer up front to go home? Bella Palmer up front to go home.
So I've got our catheter here. I've got my syringe filled with the enema. I'm going to go ahead and get all of the air out of the catheter. We're going to go ahead and lubricate that really well. There we go. That way we don't get resistance as we're inserting it. And then, so as you're inserting it, you're going to have somebody hold up your tail for you, if you could hold that, Michelle. And then you're going to go ahead and you're just going to insert it right into the rectum as far as you need to. If you do meet a little bit of resistance, if you hit some fecal matter, just kind of back up a little bit. You don't want to push too hard because you can tear that rectum. So just go as far as you need to, and then push your plunger to go ahead and administer your enema, however much your doctor told you. Once you administer it, you immediately want to go ahead and put them in a cage or outside, wherever you need to get them so they can release their bowels. If it does not work, you can go ahead and do another enema within the hour. When you're removing your enema from the rectum, you want to make sure that you kind of clamp off your catheter before you remove it. Okay, so this is Catzilla, and we're going to give her just a little bit of fluid. So I've got a brand new 18 gauge needle on here, and our doctor wants to give her just 25 mLs. And so we're going to go ahead and watch our bag. We are just below the 4, so we're going to go to about just above the 5. Giving fluids is not an exact science, so you do your best. We're going to go ahead and make sure my bevel is up, and I'm going to tent the skin, insert my needle into her sub-Q space. I'm going to go ahead and release my clamp.
Excuse me, you're stuck on
I just have to squeeze our line to get a little jammed.
You're welcome.
Alright, I'm going to go ahead and put some pressure on the bag. We've got a nice flow. It's okay, baby. I'm just going to hold that there so it doesn't come out. And 25 mLs will go pretty quickly. So I'll do it for another second or two. Okay, baby. And we'll check where we are. Alright, and we've already given about 25 mL sub-Q fluids. So I'm going to go ahead and clamp off my line. I'm going to go ahead and hold some pressure at the insertion site while I remove my needle. Make sure I get that cap on there, and that's how you give some sub-Q fluids to a cat. Alright, so I'm going to demonstrate how to place a modified Robert Jones bandage with a splint. So the first thing I'm going to do is I'm going to place my stirrups. With my tongue depressor. When I place stirrups, I'm going to make sure that I don't place the tape over top of their wound or their incision. Next thing, we're going to go ahead and place our Telfa pad over that wound or incision. And then our first thing we're going to do, we're going to take our cast padding and we're going to wrap distally from distal to proximal. And we're going to make sure we leave a couple toes visible, so 3 to 4 toes visible. That way we can look for any swelling. I'm going to try and just keep her leg extended while I wrap. Thanks. I'm making sure that I cover about 50% of the piece that I had just wrapped previously to keep that bandage on there. Keep that nice and even. Okay, and then I'm going to go ahead and use my conforming gauze. I'm going to leave a little bit of that cast padding showing at the bottom, leaving a little bit of that sticking out. I'm going to wrap it in the same manner, covering about 50% of what I had just wrapped. Thank you. Alright, and I'll leave a little bit of that cast padding showing at the top. Oops, sorry. And then next, I'm going to go ahead and put on my splint. So I'm going to go ahead and get that right there. And I'm going to roll my conforming gauze on that again. Again, working distal to proximal. 50% of what I just did. Okay, now that I've got that on there, I'm going to go ahead and put my stirrups. Twist them around so the sticky side is down. Move my toe depressor. And then I'm going to go ahead and begin using my vet wrap. I've already pre-stretched it out. Again, working distal to proximal. Thank you. I'm leaving a little bit of our under layers at the top. And then the next thing we're going to do, we still have those couple of toes sticking out the bottom. Next thing we're going to do is we're going to take some elasticon and just wrap it around that top up there. I already have it pre-stretched out as well. We're going to go ahead and we're going to cut that. Leave a little tab to make it easier to take off. And you can also go ahead and put it around the bottom as well to help prevent it from sliding. And then elasticon is, it works by heat, so you can go ahead and just hold your hands on it, put a little bit of pressure for a second to go ahead and heat fix it on so it'll stay a little bit better. So that is our putting a splint on. However, now we're going to go ahead and take off the splint so that we can complete the rest of Robert Jones, or the modified Robert Jones. So to take off a bandage, you can either peel the bandage off, or you can cut it. So I'll probably go ahead and just kind of unwrap this, peel all of this off. If you do choose to cut your bandage, you just want to make sure that you're really cognizant about where the incision or the wound is. You also want to make sure that you're just careful with your scissors so that you don't cut the patient. Okay, so for this one, I can try to go ahead and cut. Now we've got that the vet wrap off. We'll take that down and that down. And I'm going to cut on the side with the splint, so I'm less likely to cut my patient here. Alright, so we're removing all of the stretch gauze, the conforming gauze. Okay, so we've got that off of there. Move it right here. I'm gonna go ahead and remove this. So now we're gonna finish our modified Robert Jones. So we already have our cast pattern, we already have our stretch gauze. So now we're gonna have the stirrups on there. There we go. And then we're gonna go ahead and wrap for the rest of the modified Robert Jones. Jesus. I think you got it. All right, and I'm covering about 50% of what I had covered before. Make sure you stretch out your vet wrap well so that you don't get wrinkles in it. I am just reusing this just for the purpose of saving vet wraps for this video. Ideally, you would have fresh vet wrap every time. A little bit sticking out at the top there. I'm going to go ahead and take some elasticon, put it right around our toes. And then right around at the top as well, just to hold it on. And you're going to use your hands to heat fix it so that it doesn't fall off. So that's our modified Robert Jones bandage. And then to take it off, the same way as before, you can either choose to peel or you can cut it off. So we'll go ahead and get that bandage off of her. Oh, sorry. Pull that off, we've got our stirrups off, and then very carefully you can begin cutting your cast padding and your stretch gauze and your conforming gauze. Good girl. There you go. Your last thing is going to be to remove your stirrups and your tulpa pad, and that is how you place and remove a modified Robert Jones bandage. Okay, so I'm going to demonstrate how to apply an emergency bandage. So we're going to pretend that Summer here has opened her incision at her abdominal surgery site. So I'm going to go ahead, I'm going to take a tulpa pad. I'm going to go ahead and place it right there at that incision site where it opened up. And the first thing I'm going to take is I'm going to take my cast padding. I'm going to go ahead and wrap that around. And every time I go around, I want to make sure I cover about 50% of what I had put on before. You make sure you keep it nice and even so it doesn't get all twisted. Okay, and then next we're going to use our conforming gauze. Get that stretched out. Again, going about halfway the width over the last piece that you had just rolled. Okay, and you want to make sure you have a little bit of your cast padding sticking out below. Next, we're going to go ahead and use our vet wrap. I've already previously unrolled it to make it a little bit easier to go. So I'm going to go ahead and get that going. With a little bit of my stretch gauze, my conforming gauze, and my cast padding hanging out. Oops. Again, covering about 50% of what we had before. And it can be good as well to wrap in opposite directions to help with the slipping. roll. Okay, so there's that. And then the next thing you're going to do is you're going to take your elasticon, and I've already pre-rolled that as well. And we're going to go ahead and put that on our patient just to help prevent slipping as well. Right. And I like to give it a little pull tab just to make it easier to take off if somebody, when they're ready to get that off. So one right there. Bless you. And then right here across the bottom. And then give this one a pull tab as well. And elasticon does work by heat fixing, so go ahead and just make sure you push on that really well to warm up that tape so it sticks really well. So that's how you place an emergency bandage on a dog. Go ahead and do our dental x-rays. We're going to go ahead and take a picture of that upper left fourth premolar, so that is going to be our 208 right here. So I'm going to go ahead and click that, get it set up to go. I'm going to go ahead and get everything set up. So I'm going to take, I'm going to put this under here, under the tooth. Got a little mouth in here. We'll give that a shot. Alright. We'll give that a shot and see how that looks. Go ahead and take step back 6 feet.
She's still a little bit
And
out
then
of it, so I would say
X-ray.
like 5:30.
Alright, let's see what we see.
That'll work for you guys?
Alright, here we go. So you can see we've got our crown right here as well as our roots. And you can actually see that we have a fracture in that tooth. So we're going to go ahead and have the doctor look at that. I also got the first and second molars back here as well as that third premolar right there. And so that's a pretty good shot. Okay, so now we're going to go ahead and take some x-rays of our mandibular incisor. So I'm going to take my x-ray plate and go ahead, place it. It's okay to have the tongue in between. I'm going to place those right there. Go ahead, angle. Let's see.
You know what I mean? Make sure it's
Down a little bit more. Alright, and then we're going to go ahead and give that a shot. We're going to set it up on our machine right here. And then we're going to step back at least 6 feet. We're going to announce ourselves. X-ray. Alright, let's see what we got. Alright, here it comes. So you can go ahead and see all of your mandibular, our x-rays, our incisors, and so we've got our crowns there coming down to our roots. You can also see our canines as well. So that's a pretty decent shot. Okay, so here we have our dental instruments that we're going to be using today. So right here we have our tartar scaler, and that's going to be used to remove tartar and plaque from the surfaces of the teeth. And then right here we have our curette, and that is going to remove the tartar from the subgingival surfaces of the teeth. And then finally right here we have our dental extractors that we're going to use to help remove any large amounts of calculus from the teeth. They can also be used by the doctor to help remove teeth. Okay, so first I'm going to use a pair of dental extractors, and I'm going to use this to try to remove a large portion of the calculus on this teeth. So I'm going to go ahead and try to make sure that I don't actually grab the actual tooth. You have to be really careful when using the dental extractors to remove the calculus and the tartar, just because sometimes that's the only thing that's holding the tooth in the mouth, and you don't want to extract the entire tooth. starting to come off a little bit there. I'm going to try to be careful not to irritate the gum line too much as well. There we go, it's starting to come off now. It's a big chunk. There we go. And so that is how you would use dental extractors to remove calculus or tartar off of the teeth. Now I have my dental scaler, and I'm going to go ahead and use it to kind of get in these grooves right up here that the ultrasonic scaler is not going to be able to get into. So I'm going to go ahead and clean out all of the calculus and tartar out of there. And then we'll do this now, and then we'll do our ultrasonic scaling, and then we'll probably come back and do this one more time just to make sure that's all clean. And then you can also use the side of your hand scaler to go ahead and get some of the calculus off that way. See it coming clean? Oh, coming clean there. You're going to make sure you don't use the tip. That way we're not eating away at that enamel. And so that is how you would use your hand scaler. You're going to use your hand curette to go ahead and get under the subgingival area. And that's just going to make sure that there's no debris or calculus stuck down in there from when you were cleaning. Alright, so now that we showed you this, we're going to go ahead and do our ultrasonic scaling. Now I'm going to go ahead and use my ultrasonic scaler to go ahead and get some of that calculus off the teeth. You're going to make sure that you have the water spraying out when you hit your pedal. Make sure that you use the side of your scaler. You don't want to use the tip. And you want to spend no more than 10 seconds on each tooth. The reason for that is because the heat can damage that tooth. If you don't get everything off of your tooth within that 10 seconds, you can leave it and come back to another one. Still making sure you use that side of your ultrasonic scaler. And you can go in circular motion. Alright, and so that is how you use your ultrasonic scaler. Okay, so now we're going to go ahead and polish our teeth. So we've got our Prophy paste right here. I'm going to go ahead and make sure we completely cover everything that we polish. The reason for this is that way if we created any divots in the teeth while scaling, they don't fill back up with excessive calculus. So we'll go ahead and get these all polished. I'm going to go ahead and get this palatal side as well. So when you're doing your dentals and scaling and polishing your teeth, you want to make sure you do all the sides that are facing you. So I went ahead and did, get all those covered. I went ahead and did the buccal side right here, and then I went ahead and did the palatal side over here and the lingual side at the bottom. So now that I went ahead and polished those, I'm going to go ahead and rinse it out with water. And then once we get that all done, we'll go ahead, flip, and do the other side. And that's how you polish your teeth. Okay, so before you take home Rasco today, I'm going to go over a little bit of dental health care tips with you. So ideally, we want to recommend that we brush your dog's teeth daily. I know a lot of people don't have time in their schedule for it, but if you can make time for it, that would be fantastic. It would really help with that dental health. It'll also help you not have to come in quite so frequently for those dental visits. So because you did have a dental today, we're going to send you home with a complimentary toothbrush. It's similar to what we use at home. And you're just gonna do for a couple seconds, no more than about 5 seconds on each side. And you just have to worry about that buccal aspect. So just those outside of the teeth, you don't need to worry about the inside of the teeth. And just do it for a couple seconds as best you can. You wanna make sure you use a dog-safe toothpaste, which you can get over the counter anywhere like PetSmart or Petco, anything like that. You're gonna make sure to hold it at about a 45-degree angle and just back and forth a couple times to get all those teeth clean. So that toothbrush is for you. Let's see, we also recommend, if your dog really won't tolerate the toothbrushing, we recommend dental chews, which you can also get over the counter. We also have dental diets, if you're interested in doing one of those, just to promote that healthy dental care. We also have a couple extra things we can do as well. We have a Veterinet dental spray. And what this is this controls plaque and tartar. It also freshens their breath, so it's really nice to do. And all you have to do is you just lift up their little gum line and do 1 to 2 sprays on each side, depending. Small dog gets 1 spray, big dog gets 2 sprays. And that's just once a day, and you'll notice a really big difference with their breath with that. And again, if your dog won't tolerate you lifting his lip, spraying that in there, our next step is a water additive. And so what you're gonna do, it goes by measuring, so however much water you put in their bowl, you put however many teaspoons of the additive in there. It's tasteless, they're not gonna taste it in their water, they should drink it up like normal, and that's gonna do the same thing. It's gonna help control that plaque and that tartar and also freshen that breath. So these are some of our dental healthcare products that we have at our hospital. And good luck at home with Roscoe.